Welcome everyone to this special webinar event in collaboration with Microbiome Labs and Fullscript. I'm Amy Regan from Fullscript, and I'm so glad that you joined us today. A few housekeeping notes. Please place all questions you have in the Q&A box for a chance for them to be answered at the end of the presentation. This webinar is being recorded, and the recording will be sent via email to all attendees and registrants, and there's a copy of the presentation slides in the handouts section. Today, we are joined by Dr. Alex Keller and Dr. Jeff Glad from Fullscript, as well as Kara Siedman from Microbiome Labs. Welcome, everyone.
Thank you.
Thanks, Amy. Yeah, it's great to be here. Great to collaborate again with Microbiome Labs and talk about this very, very important topic that we're all seeing in our clinics on a regular basis. So I want to introduce Kara first, talk very, very quickly about Alex and myself, kind of give us the overview and then hand it over. So Kara Siedman is a registered dietitian. She's also a certified diabetes educator and clinical liaison for Microbiome Labs with over 13 years of clinical experience. Most recently, she spent the last 8 years working in a large GI practice, having built a program focusing on integrating functional medicine and nutrition into their patient care model. With a strong focus on the microbiome and overall health, Kara has guided many patients on their journey to reclaim their health and well-being, continues to grow her knowledge in this evolving field with a goal of not only providing the tools for patients, but offering up-to-date and current research surrounding all things microbiome related, which I'm sure we will all be very impressed with today's webinar. Also joining us, Dr. Alex Keller, who's our medical director. He also leads our integrative medical advisory team. As Amy said, I'm Jeff Glad. I'm the Chief Medical Officer at Fullscript. So let's jump in. As an overview, where we're going to focus today is, probably a review for many of you, but giving us just some core foundational, what is the gut-brain axis, mechanisms of the gut-brain axis dysfunction, and then we'll dive into reducing the impact of inflammation in this gut-brain axis with Bifidobacter longum, that's the B. You'll see that throughout the webinar. Bifidobacter longum 1714, B longum 35624, along with other psychoactive dietary ingredients, the synergistic effects of dietary ingredients. Dr. Keller is going to cover some of the Fullscript protocols that we build based on some of this evidence and other evidence available to us to make recommendations to our patients. We'll leave plenty of time for Q&A. So as Amy said, please use the Q&A feature. We'll handle those and answer them as best we can. But Kara, let me pass off the webinar to you.
Thank you so much. I'm so excited to be here with everyone today. We've got lots of really great information and lots to get through. So just to set the scene for, our focus today being on the gut-brain axis is, as Dr. Glad said, I'm sure we're all so familiar with this. And we obviously like to think of our gut as the second brain, and it's so intimately connected to those emotional and cognitive centers of our brain. And so this is really the gut-brain axis. It's that bi-directional communication system that links our central nervous system to our enteric nervous system and the microbiome. And this occurs through various pathways that include the central nervous system, the enteric nervous system, our HPA axis, and of course the vagus nerve, which is that super highway. It's really what connects our brain to all of our visceral organs. It's really what influences everything from gut motility to stomach acidity to digestive enzyme production. And we really like to think of the vagus nerve as the backbone to the gut, and it's really how the microbiome in the gut transmits signals and messages to the brain. So of course, when it comes to these, disorders of gut-brain interaction, so many of us are familiar with these conditions like irritable bowel syndrome. And in fact, these used to be termed functional GI disorders, and it was replaced by the term disorders of gut-brain interaction because of that false perception that functional is less legitimate. And I know I can speak to that in clinical practice, that I would have my patients say to me all the time, oh, they don't know what's wrong with me, so they just say I have IBS. Well, this new term, disorders of gut-brain interaction, really helps to bring to light that these are real conditions, and these are really following our and more consistent with the evolving understanding that we have of the multiple pathophysiological processes that determine these symptoms and the characteristics of these disorders. So obviously IBS being, probably one of the most common disorders we see, it affects so many people here in the United States. We know IBD, and what's so common with these disorders is that most often we'll see psychosocial or mood disorders often co-occurring. And in fact, in people that suffer from irritable bowel syndrome, we can see upwards to about 76% of those people actually having some type of psychosocial comorbidity. And so that really brings to light sort of this understanding and this relationship between the gut-brain axis. So let's take some time to just kind of delve into a little bit more about some of the factors and what's related to these disorders of gut-brain interaction, like irritable bowel syndrome or conditions like dyspepsia or functional diarrhea. And just really highlighting that there are various factors related to the pathogenesis of these disorders. And I like to think of them as either originating, from bottom to top, so gut to brain. And you guys can all chime in, but have you ever had those patients that, come to you and say, I never had, anxiety or this level of chronic stress prior to my GI issues starting? I know that I experience that all the time with my patients. And that's where we see a lot of these changes in the microbiome, intestinal permeability, changes in secretion and motility throughout the entire GI tract, ultimately leading to changes in the brain like neuroinflammation. Or we can have more of a top-down effect where we have, the brain impacting the stability of our microbiome. And this is really highlighted in so many of the neurocognitive and neurodevelopmental conditions we see. Like even if we think about people with autism spectrum disorder, we often see GI comorbidities in 70 to 90% of those cases. Or think about your patients who, like I always laughed when I'd have a patient come see me and they're like, well, 3 times a year, I have really bad GI issues. And it's like, well, okay, there's a lot of factors. There's a lot that comes into play. But what's your level of stress like? What kind of anxiety? Oh, well, I oftentimes, notice this in heightened times of stress. And so, that top-down effect, or it can be a combination of the two. So for our most common disorders that we talk about, IBS, mood disorders, these are really a result of having a dysfunction along the gut-brain axis, and specifically when it comes to HPA axis dysfunction, as well as dysregulation in tryptophan metabolism. So let's talk about HPA axis dysfunction. So what does that mean and what's going on? When we have chronic stress, when we have this level of, mood disorders, chronic anxiety, chronic stress is really a maladaptive process in the body, and it's really due to having this dysfunction along the HPA axis. And so persistent and chronic stress disturbs the resiliency and ultimately the stability of the microbiome. And so we see having, this high levels of stress, we see increased levels of cortisol production, which ultimately increases intestinal permeability. And this is a driver for systemic inflammation. And so we know that leaky gut syndrome, increased intestinal permeability, this is characterized by being in a state of pro-inflammation. We see elevated levels of TNF alpha and interferon gamma and interleukin 6. And interleukin 6 is specifically interesting because it's actually known to activate the HPA axis. And over time, it'll actually downregulate or decrease those glucocorticoreceptors. And so those glucocorticoreceptors are necessary because they bind to cortisol, and they create that negative feedback loop. And it's essentially created to tell the HPA axis to chill out, to take a breath, to calm down. And these receptors are essentially a feedback mechanism that suppresses the HPA axis. But when we have this downregulation or this decrease, this ultimately results in a more hyperactive, a more exhausted and sensitive HPA axis. And so a chronically activated HPA axis leads to an overactive HPA cortisol loop. So we're just stuck in this sort of vicious cycle. And we often see this being expressed as what's known as a blunted cortisol awakening response. And for those of us who aren't, aware of what that is, when we wake up in the morning, we should get this surge of cortisol. And that's really to help us get up and get out of bed. And if we don't have that, then it becomes really, really hard to get up and get our day going. And we see this blunted cortisol awakening response. It's a hallmark feature in these disorders of gut-brain interaction, especially with irritable bowel syndrome. And they're characterized by having fatigue and pain, having, obviously other GI disorders. And the more severe your IBS, the more blunted the cortisol awakening response, the greater inflammation or the greater pro-inflammatory cytokines that we'll typically see. So we also mentioned earlier that these disorders are also characterized by having tryptophan dysregulation. So a lot of our mood disorders, irritable bowel syndrome, we see dysregulation in tryptophan metabolism. And so what does this mean? And really, why is this important? So we can see that tryptophan, which we're coming up to Thanksgiving. I love it. We have lots of turkey, lots of ingested tryptophan. And interestingly, 95% of our ingested tryptophan will actually get metabolized via this pathway. It's what's known as the kynurenine pathway. And this pathway has two very distinct paths that tryptophan can travel. It can travel down what's known as this neuroprotective pathway. And this really creates more tryptophan available for serotonin and melatonin. Or it can travel down a more dark and eerie path. Hopefully by the end of our talk today, this is a path much less traveled, but it can travel down this neurotoxic pathway to create what's known as quinolinic acid. And when we have inflammation that's characteristic of mood disorders and irritable bowel syndrome or this hypercortisol production, what we see is this expression of an enzyme known as IDO. IDO gets turned on, and this is what turns tryptophan into kynurenine to further produce quinolinic acid. And this is what's neurotoxic, increasing symptoms of, sleep problems and depressed mood, irritability, decreased resistance to stress. And these are all things that we often see co-occurring with people who are suffering from things like irritable bowel syndrome. So really, just to summarize kind of this understanding of what's happening with people who are suffering from these conditions, inflammation is an activator of stress, and stress is an activator of inflammation. And both IBS and mood disorders, chronic stress, depression, these are all conditions that are characterized by being in a state of low-grade chronic inflammation. And that's what directly impacts this tryptophan metabolism or this kynurenine pathway, this pathway that dictates whether or not tryptophan is going to be more neuroprotective or more neurotoxic on our mental well-being. So I won't go through it in all the detail, but there is one point that I do want to discuss. I think it'll be really interesting for our clinicians, is that when we look at this, what's known as this NMDA receptor. So NMDA receptor, this is what's known as N-methyl D-aspartate. This is a glutamate receptor. And we all are familiar with glutamate. I mean, I'm sure many of us, and you can always chime in the chat box, but a lot of us use L-glutamine and glutamine supplementation and glutamate supplementation, especially when it comes to GI disorders. We know it's included in a lot of GI supplements. So glutamate is the primary excitatory neurotransmitter in the brain, and this glutamate receptor will get activated when glutamate and glycine bind to it. But quinolinic acid also activates this receptor. And so it can potentially lead to excessive glutamate concentrations. And if we're making excessive glutamate in the brain, and we're also taking L-glutamine or we're taking any glutamate supplementation, this can actually become excitotoxic for people. And people can oftentimes not tolerate it, or it can worsen symptoms of sleep problems or anxiety or depression, irritability. And it all points back to this dysregulation in tryptophan metabolism. So moving on, and I'm just going to pause here, because when we think about, how do we assess this? What are we looking for clinically in people who are having dysfunction, throughout the gut-brain axis? This is why I think looking at the microbiome and really intimately understanding someone's microbiome is important. We can look at certain functions of microbes. We can look at tryptophan metabolites like indole on certain tests and certain microbiome studies. You can see indole being elevated, which then we know that's impacting the amount of serotonin or melatonin that's being produced. We know that short-chain fatty acid deficiency is related to neuroinflammation and neurocognitive conditions. So lots of ways that we can clinically assess this, with our patients that we're working with.
Hey, Kara, before we move on, can you
Yeah.
go back a slide? I don't want to interrupt your flow here, but
No, we're
thought it's
good.
worth emphasizing a potential clinical pearl. So if you have an elevation of IDO and you are converting tryptophan into kynurenine, then obviously probably is not good to increase the tryptophan levels in your system, either through supplementation or through diet. And if anything, if you're trying to affect mood in that case, before you address the tryptophan levels and the conversion, then you want to focus more on 5-HTP and serotonin, since they're kind of disconnected within this pathway. Or does IDO also affect the 5-HTP to serotonin conversion?
So if we're having this expression of IDO, that's a great question, because I've also seen in clinical practice where I've given serotonin or 5-HTP to people, and it's also been sort of excitotoxic for them. And I think it's because if we have this expression of IDO, then most of the tryptophan that's being ingested is creating this more neurotoxic compound. So it's instead of, I think of it often more as, we're going to eat tryptophan, we need it, it's an essential amino acid, we only obtain it in the diet, but we have to focus on, in my opinion, inflammation. So how do we actually target inflammation so that we're not expressing IDO and we're actually encouraging tryptophan to be metabolized in this more neuroprotective path? So I think that's where we have to be kind of cautious with what we're giving people, especially when it comes to sleep issues or mood issues. And really, I'm really cautious when I work with patients, especially if I'm going to give something like 5-HTP, I often don't give anything else at the same time because I do want to see how they're reacting to it.
Yeah, I think you're highlighting a potential for a significant storm here if you're not addressing that underlying inflammation first. So maybe sets you up for the next section but this is really important, I think, as a
foreshadowing. But I think this is really just an underlying tone when it comes to a lot of what we talk about. Is inflammation is really at the helm of so many of our chronic conditions, and inflammation stems from a lot of areas in the body, but the microbiome is really, I always think of it, it's that foundation.
Yeah, it's a great point. And I'll just, before you jump in here, as you're going through those slides, I mean, my head spins of all the diagnostic pathways you could take a patient down. But I think sometimes it seems more pragmatic to say, look for the inflammation as this signal of sort of this root foundational aspect, and maybe address that first, and less going down those pathways and seeing if you can't kind of start in that keystone area of inflammation.
I agree. I think it can get kind of, really muddied when we start to do lots of different testing and we're looking at different neurotransmitters, because we don't look at the connection of everything. And so I think of, especially in what we're talking about today, these disorders of gut-brain interaction, we know there's dysfunction. Again, there's a top-down or bottom-to-top approach, and we really just have to start to link those together. And we can start pretty simply, in my opinion, by focusing on the microbiome. We can start pretty simply by working with the symptoms that people, are experiencing. Diet comes into play, obviously lifestyle, and really linking that together before potentially going down a more complicated, route. So that question that we just, mentioned is really inflammation is the focus here. So how do we curb that impact of inflammation, or how can we circumvent inflammation on the gut-brain axis? And this is where we have two very unique strains that have absolutely been studied for this exact reason. So looking first at Bifidolongum 1714. Bifidolongum 1714, this is what's known as a psychobiotic. So the people who discovered this strain and the researchers, they really coined this term, but a psychobiotic is a probiotic that exerts specific effects on our mental health. And it's really unique because of those effects. So I want to take us through a little bit of the research around this strain, because we actually have quite a bit of research. So this was a study that was looking at the effects of Bifidolongum 1714. And this was a study that was a group of 22 healthy males. And I thought it was interesting, actually, and I wanted to make note of it, that they used males. And that was really to avoid the need to control for any menstrual cycle, which we know can actually impact cortisol output. And that was one of the measurements that they were looking at. So this was a study where they looked at a socially, what they call a socially evaluated cold pressor test, where basically they submerge your hand or your foot in cold water. Now, many people do that obviously for fun these days. And I'm not one of those people who loves ice baths, but this does induce the HPA axis, and we know that. So this is used in research quite often. And they were given a dose of bifidol longum 1714, so 1 billion CFU. And they looked at various outcomes in anxiety, daily perceived stress, cortisol output. And essentially what they found in this study with just the use of bifidol longum, that there was, compared to placebo, that there was attenuation in anxiety levels following the exposure to that acute stress. So following the exposure of submerging our hand or foot into an ice bath. And there was also significantly lower levels of daily perceived stress. And we can see that here in that post probiotic group there. So really interesting, and we'll talk about some of the mechanisms behind this, but really interesting to see how, you know, a probiotic is actually impacting and affecting that neuroinflammation. The next study, I really like this study because this was a study that was specifically looking at brainwave activity. And this was another study where they looked at a social stress scenario. So the subjects in this study played a game of cyberball. I don't know what that entails, but it was a game that induces apparently a lot of stress. And I can only imagine, right? So they had healthy volunteers and they were either given placebo or bifidol longum 1714. And what they were looking at was brainwave activity during stress and as well as post-stress. And what they found in this study was during stress, there was a significant increase in those theta and alpha brain waves. So theta waves are those brain waves, that low frequency waves that essentially help us and to relax into a stressful situation, to help us work through stress in just a more relaxed way. And your alpha waves are what are most active during, you know, calmness or states of meditation. And so they found that those theta waves and alpha waves were actually increased. So it just helped us, you know, lean into that stressful situation a little bit more. And then at rest, there was a significant increase in those theta waves, but there was also a decrease in beta wave activity. And beta waves are your high frequency waves. They are the waves that really help us, the brain activity that keeps us focused. They keep us entrenched in what we're doing and diligently working on our task that we're working on. But in times of stress or when we encounter stress, we really don't want those beta waves. We really want more of those low frequency theta and alpha waves to take place. And so they found that just, again, this psychobiotic had the ability to really change that brainwave activity, which is really interesting. So if we think about what the mechanism of action is happening, and just to kind of jump to, well, how is this taking place? So 1714, bifidol longum 1714, basically blocks inflammation and stress, which we know are triggers of that neurotoxic pathway when it comes to tryptophan metabolism. And it does this because it can actually induce the production of IL-10. IL-10 is our anti-inflammatory cytokine. And if we have a greater production of interleukin-10, this has a knockdown effect on inflammation. So it can actually decrease the production or the turning on of what's known as NF-kappa B. That's our master switch that essentially turns on inflammation. And so it has this knockdown effect to basically shut off NF-kappa B, which reduces and stops that production of those pro-inflammatory cytokines. So we're going to get less of that IDO expression. And that's essentially how it can block neuroinflammation. And that's essentially how we're seeing this attenuation in anxiety and changes in stress and changes with, neuroinflammation and those effects. So really interesting that, that this strain has the ability. We see these immunomodulatory and neuromodulatory effects of it. So before I move on to our next strain, which is super interesting, just to kind of summarize again, 1714, what we call a psychobiotic, and I just love that term because it's like such a thrilling term, like psychobiotic. What does it mean? It makes me want to sing like a Talking Head song or something. But this is specifically having effects on neuroinflammation, and again, it's having this knockdown effect because of this ability to increase interleukin-10, and we're going to see something similar with the next strain that we talk about. So bifidol longum 35624. So I'm not going to quiz everyone on these numbers when we're done, but this is a strain that's been around for a very long time. Actually, it's been studied for well over 20 years now. And it's been published in more than 85, research articles in very high-end journals. And this is a specific probiotic that's been shown to decrease symptoms related to these disorders of gut-brain interaction. And we're going to look at some of the studies related to that. So this was a study that was done, and I like to point this out, and the reason I include this one is because it dates back all the way to 2006. This is, to me, pretty profound, because if you think about when the Human Microbiome Project really launched, that was 2007, 2008. I mean, this was really ahead of the time in looking at the microbiome and the microbiome's effect on the gut-brain axis and on the gut. And so I just think that's really fascinating. And this study has actually been cited in more than 1,000 publications. So this was really one of the first studies looking at 35624's ability to impact abdominal pain and distension. And this was a gold standard. It was a double-blind, multi-center randomized controlled trial. It included 20 primary care centers. And the study was really designed to confirm the efficacy of Bifidol longum 35624. They also looked at varying doses of it as well. And what they found in this study was that by week 4 of taking Bifidol longum 35624, that there was a significant decrease in basically every symptom, from abdominal pain to abdominal distension to bowel straining, incomplete evacuation. And it's important to note that there was nothing else that was changed. No dietary or lifestyle factors were included. And so pretty cool to think about, again, just, a live bug, a probiotic that has such profound effects. They also found by the end of week 4 that 48% more patients had IBS symptom relief with 35624 compared to placebo. And again, that's without changing anything else. So this was a study, this was a newer study that came out back in just 2022. And this was a study that was assessing Bifidol longum 35624 on IBS severity and quality of life. And again, similar outcomes that we're measuring, from abdominal pain to abdominal distension, overall IBS symptom severity score, quality of life. In this study, they found that just after 30 days, so not as long of a time period, but just after 30 days, that there was a significant reduction in IBS symptoms. And again, just 30 days of taking it, which is pretty interesting to think about in just such a short period of time. And they also found that after the 30 days, 66% of patients experienced a clinically significant reduction in disease severity. And to me, that has a lot of clinical meaning behind it, that if you think of your patients who are, experiencing symptoms every day, to have 66%, reduction, to have more than 50% reduction is, like I said, clinically very significant. And really, gives, I think for these patients experiencing it, it's just something to really try to help. As we know with our IBS patients, right, this is a long-term condition, and symptoms and severity can really range, and to see that significant in just 30 days, to me, is pretty profound and pretty cool.
Kara, sorry to interrupt. I just want to clarify. This was after 30 days, but it says here as well, reported over a 10-day period.
So they just... Yep. So this was just kind of a subsect that they looked at, that over, an initial 10-day period, that symptoms reduced by half. So basically saying that some people had pretty significant reduction even sooner than that, which is pretty cool.
Which is remarkable. Yeah.
Because we all respond differently, right? I mean, I think that's, and everyone's going to have a different response. And we'll talk a little bit more again about some of the mechanisms behind it. But yeah, I think that's pretty cool. And it just gives a lot of tools in our toolbox when we're working with these patients that have, such profound symptoms. Good question. So this is hot off the press. This is a brand new study that just came out this past August of 2023. And the objective of this study was also to evaluate the effectiveness and the tolerability of Bifidol longum 1714. And we're looking again at adults with irritable bowel syndrome. And they looked at similar dose, 1 billion CFU. And they looked at IBS symptom severity score as well as total IBS symptom score. And this study found, and again, this is our most recent one that just came out, that there was, again, significant reduction in the total IBS symptom score. So we had a 43% reduction, which, again, fairly significant in a pretty short period of time. We also saw after 8 weeks that we had improvement in mean IBS symptom score. And so essentially over the course of this 8-week study that they found and concluded that 35624 was associated with significant clinically meaningful symptom relief, in a typical patient of adults that are suffering from irritable bowel syndrome. So how is this all happening? What's some of the mechanism behind this strain, and very similar to 1714 that we talked about, but bifidolongum 35624 also has the ability to increase interleukin 10, that anti-inflammatory cytokine. And so this really helps with establishing a healthy tolerance within the immune system. And we know that immune tolerance is important to prevent inflammation. And so by achieving immune tolerance, this is essentially how we're able to reduce visceral hypersensitivity. And so again, it's really noting the anti-inflammatory and immunomodulatory effects that these strains have. And these strains are actually unique. I didn't go into some of the science behind it, but they actually have a special coating on these strains. It's what's known as an exopolysaccharide coating that also has its own anti-inflammatory effect. So it's almost like a double duty effect that this cloak, we call it the Harry Potter's, invisibility cloak, because this exopolysaccharide layer allows these strains to really go incognito and evade any immune activation. And again, we get sort of a double effect of this anti-inflammatory effect. So really unique. Again, just really unique when you see some of the intricacies. And that's why we say it's always important to really intricately know and understand the microbes that we're working with.
Kara, and you don't need to go backwards in the slides, but on the studies that you're presenting, I mean, that's largely independent of any other change in diet, right? It's literally the benefit of the probiotic driving that improvement.
Yep, they're all like free living, and there was another study, it's coming out, it was another, I think it was just on 35624, where they did a subgroup of people who failed low FODMAP diet, which we know doesn't work for everyone with IBS. And so that one should be coming out soon. But looking at, again, just the effects of these strains without any changes to diet, any changes to lifestyle, and that's why it's really highlighting not just the immunomodulatory, but obviously in 1714's case, the neuromodulatory effects of it. So really unique.
Kara, we had a good question come in here from Marcy asking, did it matter or does it matter what the root cause is to the symptoms? And she's giving an example where she has clients where she's working on mold detoxing and their gut symptoms seem to be coming from the root cause of the mold. So in this kind of a scenario, would this strain have a benefit?
Oh, I think so. I mean, obviously the studies are being done, especially 35624, and we'll talk about some other studies combining the two strains. But I think, in my opinion, and if you ever talk to me outside, I think most people benefit from taking these strains because of the effects on inflammation. And if you think about people who don't have a healthy tolerance, what decreases oral tolerance, what changes immune tolerance, is this elevation of inflammation. So if we have something to circumvent and curb that inflammation, it's just going to help the big picture. So yes, I absolutely think it's helpful. I mean, I make everyone in our family take it because I think it's just good. So
I think the important part of your answer there is that it's addressing inflammatory pathways. So
yep.
if the cause of the inflammation is mold, or if it's a food allergen, or if it's something else, then what this strain is really doing is it's reducing inflammation. Mm-hmm. That's it, right? Like that's the primary focus. Yep. So it's not necessarily addressing the root cause. If you still have mold toxicity, you probably need to address the mold toxicity, but you can improve the inflammation and therefore the gut-related symptoms with this strain.
Yeah, and if you think about conditions, whether we're dealing with autoimmune or mold toxicity, these are driving changes in the microbiome. We see dysbiosis, we see changes in microbiota composition. That's going to drive intestinal permeability. That's going to drive this state of inflammation. So, your low-hanging fruit may be mold toxicity or autoimmune, but as we get further down to our foundation, we see a lot of the similarities there.
Yeah. A couple other questions come in here on dosing. So it didn't seem super clear. We've got two people, and hi, Michael. I see Michael Stanclifton here, asking about what's the dosing and the dropout rates for some of these studies. Do you have any details on that?
Oh, I have to go back and look and see if I have dropout rates. I think I have to go back into the studies. That's a good question. And I don't know them on the top of my head, but most of these studies were looking at a dose of 1 billion CFU. And that's, and you'll see in some of the products that, in some of the researchers that say, okay, if we do higher dose, potentially we can achieve that tolerance faster. And one thing we'll talk about when we come up to some studies is, the effects of these strains, they're transient. They do wear off after you stop taking it. And so most of these studies, we're seeing the effects really within that 4-week period, sometimes 8-week period. But as we go through some other studies, once people stop taking it, we'll see the effects of these strains actually wear off. And it'll bring us to a conversation of talking about, well, what are these strains doing? Are they tourists? Are they colonizers? And their effect is really much more transient. So dosing does matter. One of the earlier studies, that one that was done in 2006, they actually were looking at varying doses, and they said that the higher dose in that study, they had issues with the clumping and the pill itself. So from the researchers, and when we talked to the people who've discovered these strains, they found that this, 1 billion has been sufficient to achieve these results in the studies that we're looking, but higher may actually be better. Maybe you achieve those results sooner and faster. That's off-label, of course. I mean, we don't have those studies done.
Awesome. One more question, and then we'll let you move on because there's still plenty of time. Somebody was asking about timing. Should you be taking it with food, after food, before food? Is there any specific recommendation there?
That's a great question. And I'm a clinician that wants people to just be successful in taking supplements. So I always say whenever you take it is better than not taking it at all. But ideally, we would like to take these with food because we know that food can help. Obviously, we have that symbiotic effect. So I usually tell people to take it at a meal. I think that's better. And we can talk, as we go through what not to take it with and things like that. But ultimately, I would say take it at a meal. But if you forget, still take it. The benefits are still there. We just know that food helps to, bring these microbes, that again, we create that symbiotic relationship and effect. So.
Awesome. If there's more questions, we'll come back to them.
Perfect. Okay. So other additional ingredients, and these are just some other studies, to highlight that we have lots of, psychoactive dietary ingredients out there that we've had lots of great studies on. This is one specifically looking at saffron, and saffron, in general, if we look at the results here, we know that saffron from lots of different studies can improve sleep quality, can help maintain a positive mood. We know it has anxiolytic effects, meaning it can help alleviate anxiety. Saffron's also been shown to support and induce relaxation, and we can actually see that from this study here. And everyone will get these slides, so I'm going to move through these a little bit faster so we can make sure we have time for questions. But this was a study looking at lemon balm, another ingredient that has been shown to increase potentially drowsiness, so something that can actually help us fall asleep. So if we have issues with falling asleep, this is one that can actually be pretty helpful. We know that lemon balm has been shown to actually calm occasional nervousness. It helps to support our mood. It actually can help support the production of GABA as well. And then the results from that study, like I said, I'm going to kind of move through these a little bit quicker just so we can get to what happens when we combine these strains together. L-theanine is another additive that's really helpful when it comes to improving sleep. We know it's found in high concentrations in green tea, so just another reason we should be drinking more green tea. But it helps to support neurotransmitter production like serotonin and dopamine and GABA. We know it also produces a more calming effect while also, and what we talked about earlier, it supports those alpha brain waves, so the brain waves that are associated with more relaxation and calmness. And then B vitamins is another one. We talk about B vitamins a lot for lots of different reasons, but we often don't think about B vitamins having a role in brain health. And specifically, we can look at certain types of B vitamins like B6, which we know helps to support healthy neurotransmitter metabolism. It can also act as a rate-limiting cofactor to convert glutamate to GABA, which we know helps to support mood. We see B6 also being a cofactor in the conversion of 5-HTP to serotonin, which we know helps to support happiness. B12 is obviously involved as well in serotonin synthesis, and that can also help support calm mood and a positive mood and positive coping mechanisms. So when we get to the synergistic effects, so what happens when we combine a psychobiotic with a probiotic, we get targeted effects. We get a targeted dual strain probiotic that really works on the gut-brain axis, that works specifically on everything that we've been talking about for the last 40 minutes. So this is a study just come out in 2023 that was looking at 40 patients that had IBS that were either mild to moderate that also experienced anxiety. And they looked at various outcomes from abdominal pain to abdominal frequency, but they also looked at cortisol output as well. Excuse me. And what they found in this study was that after the 8 weeks, you can see here that there was significant improvements in IBS symptoms and significant improvements in overall symptom severity. And we can see that overall IBS symptom severity reduced by 45% on average. And we also saw, and we'll talk about this in a couple of slides, that there was significantly higher levels of baseline cortisol compared to those non-IBS, which just shows that impaired cortisol awakening response. But I do want to make note. So here we could see this decrease in symptoms by week 8, and then there was a washout period during this study. So that means they stopped taking the supplement and symptoms slowly, gradually started to come back. And this is why when we talk about probiotics, and this can be a discussion that we have at the end of, what probiotics are doing. Are they more transient, or are they actually changing and modulating the microbiome? Well, what we can see with these bifido longum strains is they're not colonizing, that their effects are more transient, and that they're not actually modulating the environment of bifido longum, but they're just having more of these specific effects on neuroinflammation, on inflammation, on these symptoms related to these conditions we're talking about. So unfortunately, when you stop it, unless we're, doing other things to get at the root of the issue, most often symptoms do come back. And so we can talk more about that as we move on. But I think that's a really important note to make. And this is just brings to light a larger conversation around the world of probiotics. They also found significant improvement in depression and anxiety scores as well. This is what's known as a real world evidence trial. This is a type of research. I love this type of research because it's not as expensive and you get more real world evidence. It's a way to conduct research that's a little bit cheaper and faster, which helps, we all want the data. So this was a study that looked at the dual strain and the combination. This was 55 adults with IBS. And I just want to make note here that 85% of people with IBS reported psychological symptoms. So again, just really bringing to light how often we see psychological comorbidities. And so they also looked at, again, abdominal pain and abdominal distension, and obviously mood disorders from stress to fatigue. And ultimately, we saw a significant reduction in pretty much every marker. We saw significant reduction in abdominal pain and distension. You see here that mood goes up because they were measuring good mood. So we had improvement in mood, we had improvement to daily life, which again, without changing anything else, no change in diet, no change in sleep or lifestyle or any habits there. So when it comes to the cortisol awakening response, the dual strain probiotic, so as we mentioned before, IBS symptoms are often correlated with that blunted cortisol awakening response. So we're not getting that surge of cortisol to get us up and get us moving. And the more blunted your cortisol awakening response often correlates to the more severe your IBS symptoms. So you can see at baseline, cortisol awakening response was blunted in patients with more moderate to severe IBS. And you could see that dual strain 1714 and 35624, the combination increased that cortisol awakening response in those subjects, which is interesting. And we saw then, further following along, that the restoration of the stress response following supplementation is really important because it actually can correlate and correspond to symptoms and symptoms that people experience throughout the day. this is a study that we did that just came out this past summer that is looking at the synergistic effects of not just the strains themselves, but also those other psychoactive ingredients that we mentioned earlier. And so this was another real world experience program. And so you can see in the morning, they took a capsule of 1714 with some B vitamins and some saffron. In the evening, they took a capsule of 1714. You can see the dose is actually a little bit higher than what was done in all the other studies. 1714, and that also included some L-theanine and lemon balm. And again, various measurements of stress and anxiety and mood, overall well-being. They also looked at, everyone had to use their wearable device, and they also looked at sleep outcomes. And what they found in this real-world evidence trial was that basically there was, over the course of the 8 weeks, there was on average an 88% improvement in symptoms or reduction in symptoms. And this actually equated to around 2 to 3 days, which to me is clinically very meaningful, that if someone's experiencing symptoms 5 days a week and they go down to 2 days a week, to me, that's a success. I can understand why people felt like they had improvement in quality of life and improvement in their fatigue and everything. So on average, you can see pretty much every symptom had improvement over that period of time. They also found, looking at the wearable device, that obviously with current research, we know most adults are not getting that recommended 7 hours of sleep. And current research actually shows that 26 to 33% of adults fall short. I actually would argue, I would think that that number is actually higher. I don't know about you guys. I try to get my 8 hours, but it doesn't always happen. But what they found in this study with the wearable device, that taking the bifidobacterium 1714 actually improved sleep by 13 minutes. And even more important was that we had an increase of REM sleep, which is that much deeper sleep that we often strive for. And the other thing that I always like to point out from this study too is that subjects actually fell asleep 20 minutes faster, which is pretty cool. 20 minutes. I mean, that's, pretty cool. I wouldn't mind falling asleep faster. So obviously I'll hand it off, but I think what's really neat to show is that these strains, which have actually been looked at for their compatibility, which is really cool, that we know that there's been research, actually really cool research that came out in 2016 that showed that the combination of strains can sometimes negate their beneficial effects. So these strains were studied for their compatibility, and when combined, we actually see improvements in these markers that we know are dysfunctional, or these conditions that we know are driving really what's happening along the gut-brain axis.
Yeah, that's great. Quick question that came in, and kind of relates to, you touched on a little bit before, but it also showed, the study where the symptoms return upon stopping the probiotic. What's your typical guidance, to a patient in terms of expectation of how long to take this consistently? What does it look like to kind of, are you weaning them off slowly? Just, any quick insight there.
Absolutely. And I think this is really, I'll just kind of speak how I use this clinically. I'll often start people on this right away because I want to try to work towards getting people to feel better. If people start to feel better, then you have a greater chance of actually working on those root mechanisms, because we know that getting to the root of the problem, actually fixing and healing people's microbiome, takes time. So I tell my patients, hey, listen, the studies show that clinically we see clinical improvement within sometimes a month, up to 8 weeks. I often dose up a little bit higher initially to try to get them to feel better sooner. But while we're taking this, we're also going to be working on the root mechanisms. And if we get you to a place, 3-6 months down the line where you're like, hey, I feel pretty awesome, let's stop everything. Let's see. But I'm pretty honest up front and just say, this is really helping your symptoms, but everything else we're doing, from diet to lifestyle to modulation of the microbiome, to all the things that we know are necessary to really help people that are suffering from these conditions, that, we're going to simultaneously work on that. But I'm pretty honest. And honestly, if they feel better on this strain and they don't want to do anything else, then I just say, all right, you're on it forever. And
it's, I think that's, again, a really good call out, that a lot of people just assume you take probiotics and you're kind of healed, but it doesn't necessarily the healing doesn't stay unless you actually address the root cause. So this is in a sense a bridge to get you to where you need to be with symptom management. And if, like you said, if you're not addressing the root cause or it's not possible to, then at least this gives you that bridge for the rest of your life if you need to.
And it would be cool to see, you know, maybe something we can suggest as we do some more of these RWE trials is, can we see some of the same symptom improvement if we take it 3 days a week? Or, you know, is there a maintenance? And that's actually, you know, gave me an idea. Maybe we'll pose that as a trial, but that would be really cool to see, because we know these strains are typically out of the body, you know, within a few days to a week or so. So they really are transient in that, you know, they really are tourists in the body.
Yeah. I mean, one thing that it could have a benefit on is if you have chronic anxiety, depression, or some sort of other mental health concern, and this helps to alleviate the symptoms, often that is enough to start addressing those psychological symptoms.
100%.
To then prevent further GI issues down the line, right? So it can be a cure in that sense, even if the strains themselves are transient.
Oh, absolutely. I mean, I'm always, you know, my philosophy, I want to fix people, obviously, so that, you know, we really, you know what triggers people's symptoms, but I also want them to feel better. So this is just, again, another tool in the toolbox to help people, because most of us in the functional world, our patients have seen so many practitioners. I hear this all the time, like, you're my last hope, you're my last resort, which, you know, puts a lot of pressure on us as practitioners. But anything in the toolbox to actually help them feel better, because that gains that trust in, like you said, you know, working on root mechanisms and root cause, and getting people to want to start to actually heal themselves holistically, fully.
Yeah. Awesome. You've shared a lot of valuable information here, and we're going to get back to some of the questions. Just a quick section here to talk about how to apply the knowledge that you've shared today, and how to use some of the appropriate products in Fullscript as well. So first of all, we've created 2 protocols here that go beyond these strains. The nice thing about the strains and the additional ingredients that you talked about is that in the ZenBiome suite of products within Microbiome's catalog, there's these products now that contain these combinations of ingredients. So we haven't spoken about the products in today's presentation so that we can lean more into the evidence, and we're deliberately keeping them out here. But what we did here as well is we assembled 2 different protocols, which if you scan that QR code on the slide, it'll take you to the protocol pages. And we've combined other ingredients that are beneficial for either nervous tension or gut-brain axis support as well. So check those out by scanning the QR code, and from those pages, you can then go and apply them directly within Fullscript as a treatment plan for your patients. We also, as part of this, created a new patient handout related to the gut-brain axis. So similar again, if you scan that QR code, it'll take you to your account into the resources section where you can see this exact handout. And this is a great add-on to a treatment plan when you're using these kinds of ingredients and when you're treating these kinds of conditions. And then generally, obviously, you know, we're here to help facilitate care and the delivery of care. And so, you know, our partnership between Fullscript and Microbiome Labs is intended to continually bring these innovative strains and products to market and allow us as practitioners to be able to prescribe them as efficiently as possible. So if you go into Fullscript today and you search by these ingredients, you'll be able to find the appropriate products and then based on those. All right. Last one here again is if you scan these QR codes, you can learn more about what Kara has presented today, either on the Emerson site or on the Fullscript site. And then from there, you can go into the Fullscript prescribing experience directly. Let's wrap up with some questions, because there's some great ones that we still haven't had a chance to address. And we've got 7 minutes here where we can dive into a few of these. I'm going to go in order just to keep it fair, and then we'll hopefully get through most of them. But wow, we have a lot coming in here, so we run out of time. And if we run out of time, then ideally what we try to do is capture all the remaining questions, answer them offline, and then we'll send them with the follow-up email after the fact. Sound good?
Yep.
All right. So, Kara, going back to the tryptophan pathway that we addressed earlier, Victoria was asking concern about tyrosine as being an excitatory compound. Any input on that? Is there anything here that we need to consider?
You know, I think in general with a lot of these excitatory, you know, compounds and agents, that especially in light of what we're talking about today, that we have the ability to, multiple ways, obviously from these strains, even, diet to modulate or to help to fix that tryptophan metabolism. So I always say, if you're concerned with too much excitotoxicity, then to be very cautious with any types of compounds that you're using in supplements, and to really work on, again, the root mechanism. And we know so much of this stems from changes in the microbiome. And I think that's a great place to start before we start adding in some of these other compounds that could potentially not be received well in our patients.
Yeah, great answer.
Yeah. Next question, Kara, is any interactions or cautions that you're aware of alongside of patients taking antidepressant medications?
None at all, actually. And I think it's a great adjunct. I mean, I often, if I have patients taking antidepressants, taking lots of anxiety meds, then I definitely would recommend this, and no contraindications whatsoever. Only positive benefits. I haven't heard, and even personally, my husband's like the worst sleeper in the world. And this has been really helpful for him. I mean, we've tried everything. I've done every trick in the book,
Awesome. Tina was asking, would the GI map be a good tool for assessing any baseline issues? And that's going back to the tryptophan discussion again. How would you assess for regulation of IDO and making sure that that's something that's being actually addressed?
So GI map is one form, that uses a specific type of technology, what's known as the 16S technology. At Microbiome Labs, we also offer a microbiome assessment, what's known as a functional microbiome analysis. And that's a different type of technology. It uses what's known as whole genome sequencing. And I like that because it's the only way that you can not only see who is in the gut, so you get taxonomic profiling, but you can actually see how the microbes are functioning. So we can look at GABA production. We measure indole because that's an actual function of our microbes. So I'll often see on biome effects tests that indole is elevated or GABA is not detected or it's really low. And I'll ask, the client about their sleep, their anxiety, and it gives us a way to sort of formulate those adjustments and make those specific dietary or supplement recommendations. So to me, by really looking at how our microbes are functioning, that can actually tell us a lot more. Again, measuring short chain fatty acids in functional analysis, we're looking at the microbes that actually produce the genetic capability of our microbes to produce short chain fatty acids, which can often be a better representation. So if we have low short chain fatty acid production, we know that that's associated with neuroinflammation. We see short chain fatty acid deficiency. So lots of ways, but yeah, I think you can look at certain microbes that we know play a role in neurotransmitter production. And so knowing our microbes can be very helpful in that sense.
Yeah, excellent. I'm going to try to combine a couple questions. If the question doesn't get answered appropriately, again, please ping us and we can do a deeper dive. But question about forms of B vitamins, specifically B6 and B12.
Yep.
What stage, if the gut is compromised, would you recommend supplementation? And a connected one was a question about, the specific forms in Microbiome Labs using hydroxycobalamin and pyridoxine versus P5P. Anything you can add in terms of just discussing B vitamins and forms?
Absolutely. And I think so we get this question actually quite often. And I do want to make a note that what was added, the B vitamins that are actually added to this, it is in such a small quantity. And I think that they were added because of what we talked about with B vitamins and B6 being a cofactor for 5-HT production. So really small quantity. We also know that not everyone responds well to the methylated forms of B vitamins. So I think because the quantity is so small, I think, and I wasn't on the formulation side at that time. And so I think that it was thought of, it's such a small quantity that we're really using them as an adjunct and cofactor in just supporting overall mood. So yeah, we get that question a lot. I mean, again, I like, and certain people need methylated forms. I love P5P but these are they're such minute quantities.
I think we've got time for one more question and then we'll have to wrap it up. Sorry, I just lost. No, Denise was asking any negative impact if someone has SIBO.
No, I mean, great question. And SIBO obviously is multifactorial. And we know that actually SIBO can be considered sort of in and of itself a disorder of gut-brain interaction because we know, when we have high LPS, that can actually bind to the dorsovagal region of the brain and slow motility. So I actually love adding this right away, in SIBO patients. I think, obviously you have to be cautious with what types of probiotics, but I've seen really great results because it's actually helping to reduce that inflammation that's actually taking place in the small intestines. There was a great study that came out in 2023 of irritable bowel syndrome and looking at IBS as happening, pathophysiology taking place in the small intestines and not just what we believed was happening in the large intestines. So we see altered microbiotic composition. We see this T cell differentiation that's promoting more of these pro-inflammatory cytokines. So I actually think if we can help to flip that switch, help to establish immune tolerance, that this may actually be beneficial for those patients with SIBO. But I'm always cautious with, just add it in slowly, see how they do. But I have seen great results in our SIBO patients, and in fact would add it in right away.
Fantastic.
Yeah. Incredibly helpful. Yeah, Carrie, your expertise has been helpful. There is Amy to wrap us up and send us home.
Excellent. Thank you so much to everyone everyone who attended today. And thank you so much to Kara and Jeff and Alex for this great presentation. Everyone look out in their email for a link to view this recording. And I'll also coordinate any of the questions we weren't able to answer today and send them over to all the question askers. Anyone who has any additional questions can send them over to me at amy.regan, REGAN, @fullscript.com. And I hope everyone enjoyed the presentation and has a great rest of their day.
Awesome. Thank you, Amy.
Thank you, everyone.
Everyone.
Thanks, Kara.
Bye.